Yeah, in research that we did over the last decade at HealthNEXT, we have identified 10 pillars and at least 50 factors that employers need to evaluate and assess against. And our research shows that those companies that pay attention to these 10 pillars and to these 50 factors to the extent where they're operating at near benchmark excellence with many, if not all of them, they have those organizations who've been able to distinguish themselves this way have solved their healthcare cost trends and have demonstrated that their workforces are getting healthier over time. And as I mentioned before, have demonstrated superior performance in the marketplace. What we have found, as stated on this slide, is that you can't just do one thing. Often when I'm on a podium, an employer leader will ask, Ray, what are the 3 things I need to do to solve this problem? So sadly, as I've mentioned, there's 50 factors that need to be focused on. And our research shows that you need to do at least 35 of them, maybe even 36 or 37 of them very well. So this is a complex issue, but it's a manageable issue. It's an issue that can be addressed, as I said, over a multi-year strategic plan. The other point that's on this slide that I want to emphasize is that our research has demonstrated that these critical interventions need to be done in the right sequence. And in particular, as we started off and Mike made some eloquent comments, early on, you really need leadership support and management alignment. Once you have leadership support and management alignment and a multi-year strategic plan, you're off and running. Both of those issues are fundamental and are, based on our research, recommended to be done early. And the mere selection of a number of point solutions with contracting, perhaps on an annual basis, will not get you, based on our research, where you really want to go. Mark?
Yeah, I think the other thing I think you sort of brought up is this: it's complicated, and there's lots of moving parts, and there's lots of different sort of vendors in this space. So many organizations will have, there'll be interventions from the healthcare benefits side. There might be some HR interventions. There might be some health and safety interventions. There might be some DE&I. There might be some recruitment interventions. Often all using third-party vendors, and often what happens is none of these things talk or connect or join the dots, and they don't understand how you transition from one to the next and how you can get value from them. So many organizations really aren't getting that true value because, all right, they're throwing a financial sort of solution at their employees, and they're also having an EAP, right, and some